I'm Dr. Lisa with House Paws Mobile Veterinary Service, and we're going to learn today what to do to monitor your pet with diabetes at home so that we can help regulate your pet as tight as possible to help them from getting complications from diabetes. Some of the complications from diabetes are obvious, like drinking more and peeing more and weight loss, but if they're not controlled, some really bad things can happen. They can get severe dental disease, they can get chronic urinary tract infections, they can get cataracts overnight. So we don't want you to wake up tomorrow with your pet having cataracts when they can see fine today. And one of the ways that we can avoid those problems is to have your pet very tightly regulated with its insulin. So there's a few things that you can do. If you have a very agreeable pet and you're really good at drawing blood and stuff like that on your pet, which we would show you how to do, you should, and the best way to monitor glucose at home is to have an AlphaTrack glucometer kit. This kit is the only kit that's made for pets. Dogs and cat cells are smaller than human cells, so if you use a human kit, it's going to be off from anywhere from 20 to 50 points, whereas this kit is very exact. If you have a kit, or if you need to know how to use a kit, you can certainly make an appointment, or if you've already had an appointment and you want to refresh your course, you can watch Lewis's video on how to use the AlphaTrack glucometer kit. If you can't use that, don't be discouraged. And if you can use that, we're going to come back to that. There's a few other things you can do. Your vet or at the local pharmacy, you can get some urine strips. Urine strips comes in different forms. This is a very extensive urine strip. The only urine strip you need has two things on it, glucose and ketones. If there's too much glucose in the blood, it's going to pour over into the urine, and you'll see excess glucose in their urine. There shouldn't be any glucose in the urine in a normal dog or cat. In a diabetic, we should see a little bit. If there's a lot of if there's a lot of glucose in the urine, that means that your pet is not regulated well. If you see ketones in the urine, that means your pet is becoming toxic from the diabetes and needs to see a vet as soon as possible. So the urine strips have a bunch of these little squares on it. The urine strip you're going to get is only going to have 2 squares on it. And what's going to happen, ideally, is you catch the urine from the dog or the cat. If you're doing a dog, you can simply put a bowl under the pet when they pee, or a ladle. If you're using it with a cat, some owners are pretty good about catching it with a ladle when they pee. The other thing you can do is from the vet, you can get some little crystals that you can use as litter, and the crystals will catch the urine. You can also use dried beans. Put a splash of dried beans in an empty litter box, and when the cat pees, you'll be able to pour off the urine. You're going to dip the urine. You're going to dip the strip into the urine. I have a glass of not urine. You're going to dip it into the urine, and then you want to be careful to hold the strip straight, so that if you hold it this way, the urine's going to pour down and the colors are going to bleed from the things above it. So you're going to hold it straight, and then you're going to kind of hold it next to the color chart on the jar. And you'll see that there's numbers on the jar. For instance, it said I should read the blood in 60 seconds, the bilirubin in 60 seconds. In your case, you're just looking at glucose and ketones. You're going to measure the colors and then record what you see. So in this case, up here, you'll see that the pH is orange and it says negative. So I have a negative pH. For glucose at 60 seconds, it's yellow. That means I have a negative glucose, which makes sense because I'm doing it with water. But and that's basically how you read the urine. That can come in really handy, and if it shows anything other than negative or trace, you should report it to your vet, or keep a log that you can show your vet once a week or as your vet recommends. The other important thing to do is to have a log. Most vets will give you a log if you're having a pet with diabetes. The log works a few ways. One, if anyone else is caring for your pet, like your husband, your kids, everybody should use the log so they know who's doing what. For instance, if I give the insulin and I forget to put it on the log, or I forget to leave my husband a sticky note, and he gives the insulin, now we've given the pet insulin twice. And we see that emergency happen all the time, and that can make the pet's glucose plummet and puts the pet into an emergency situation. So the way the log works is you put the date, the time, whether or not the pet's appetite is normal, and if not, you circle what the pet's appetite is. If you have a diabetic pet that's not eating, don't give the insulin and call the vet. If you have an AlphaTrack home kit, if they're not eating, take the sugar and call the vet, because the vet's going to ask you what the sugar is. That's why it's so important to have a kit. The dose of insulin that you give, you're going to write down. And again, you already wrote the time down. Whether or not their activity level is normal. And any notes that are important. He vomited, he's eating more excessively, anything like that you're going to write down. Over here, I have the urine chart. In case you're using the urine strips at home. You wouldn't do this every day, but I like my clients to maybe use it once a week, or if they think there's a problem. So you're going to write the date, and then there's a space for ketones and glucose. You're just going to write negative or trace or 4+ or whatever the result is that you're reading from the strip. Finally, there's a section right here for if you're running a curve. A glucose curve is basically where you take a blood glucose reading with your AlphaTrack home kit. And again, if you watch Lewis's video, he'll show you how to do it from the lip, from the ear, from the lip, or from the foot. So what you do if you're taking a curve is you basically are taking the blood pretty much at the time of breakfast, every 2 to 3 hours until the time of dinner. And then you give the vet that information. You write it down on your sheet. And then the next day you call the vet or email the vet and give them that information. When they put all this stuff together, they can say if your pet needs more or less insulin. It's very important that when you have a diabetic pet, you stay in close contact with your veterinarian. Dietary changes, different nutritional supplements, and of course the information that you're collecting at home can help us make your pet with diabetes be very successful and healthy and avoid other problems that uncontrolled diabetes might have. So we want your pet to be as healthy as possible for as long as possible. So good luck.